Hello, everybody. Welcome. Thank you so much for joining us today for SKC's Expert Roundtable, where we're going to be discussing best practices for businesses reopening during the COVID-19 pandemic. My name is Amber Lesko, and I am the Marketing Director here at SKC, and I am very pleased to be the facilitator for today's conversation. Before we begin, I do just want to take this opportunity to review some of the logistics for our session this afternoon. First, you will notice that all participants are muted. This is really just to help ensure that our experts can answer your questions without any distractions. Even though you are muted, we do encourage you to submit any questions you have. If you look over to the right, there should be a chat bar on the side of your screen, and you can input your questions there. Some participants did submit questions in advance of our session, so we're going to begin with those. After that, we will try to get to as many of your additional questions as we can, but don't worry, if we don't happen to get to your question by our 2 o'clock end time, we'll be sure to follow up with you afterwards. Now, I'd like to give our expert panelists an opportunity to introduce themselves. We're going to start with somebody I enjoy working with very much. Her name is Lucinette Alvarado, and she is our Corporate CIH and Technical Services Manager. So Lucinette, take it away.
Hi, hello everyone. My name is Lucinette Alvarado, and I'm very happy to be with you this afternoon to discuss, the topic that it's on our heads every day, which is COVID-19 and how we can go back to work safely. As I mentioned, I am the corporate CIH at the site and the technical service manager, and I always help the customers out and also our employees at the site. I'm also part of the AIHA board of directors as a director. So looking forward for our discussion today.
Wonderful. Hamid, would you like to go next and introduce yourself?
Yeah, by all means, if you don't mind, if Doug can go next, I'm just trying to fix some things here. So I'll be with you in a second.
Sure. Doug, would you like to introduce yourself to the group?
Sure, you bet. My name is Doug Dallas, president of SKC Inc. for about a year and a half now. I've been in the industrial hygiene world for, almost 40 years now. And so I'm honored to be on this panel today, and look forward to hearing the expertise from Lucinette and Hamid. I would like to add some perspective, some of my perspective as the conversation goes on. So please send us your questions. Thanks.
Okay, and Hamid, would you like to finish us off here with introductions?
Yes, good morning and good afternoon to everybody. It's a pleasure to join colleagues and everybody on this panel and in the audience. My name is Hamid, and everybody calls me Hamid with a more difficult last name. I have, Doug has me beat by a few years. I started in industrial hygiene in 1986. I've done my background is I studied engineering, and then got 2 graduate degrees in industrial hygiene and occupational health. At present, I'm an adjunct professor at UCLA, where I teach graduate courses for our masters and students going on to PhD. I've also have a unique background because I work for government, industry, and do consulting and in academia. And I've worked with my colleagues at SKC, and I've known Doug for a long time. So I'm very pleased to be on this panel and be happy to discuss and answer questions.
Good. Thank you so much, Hamid. We're grateful to have you joining us here this morning, this afternoon, wherever you are here in the world, right? And so I think, Hamid, actually, I think we will start with you, if you don't mind. So as I mentioned before, many of our participants did submit questions in advance. And we thought it might be good just to kind of kick us off here with what might seem like a basic question, but I think is going to be good to give us a real foundation to build on then for the rest of our session. So, you know, in a couple minutes, and I know it's tough, but if you had to think about what really are the basic principles to consider when reopening a business during COVID-19. I know we talked a little bit about this before, so can you maybe kind of walk us through what those basic principles in your mind would be?
By all means, and I want to just check again, can you hear me okay?
Yes, I hear you very well.
Perfect, okay. So again, the greetings to all. And I always say that those of us in occupational health and safety, and I include everybody in this field, from equipment manufacturers to those who do the lab analysis, we are a very large and varied group, and I call all of us public health practitioners. That can be occupational health nurses, physicians, epidemiologists, toxicologists, and industrial hygienists. So in this family, we have been kind of talking about the general realms of preventive public health. And many of us, along with many other scientists, microbiologists, biologists, and as I mentioned, epidemiologists, have always been very concerned about microbiological issues, epidemics, pandemics, and many of us have been warning about these. People are a lot smarter than me. But I remember once I was giving a talk in Southeast Asia, and I mentioned that if world leaders and politicians knew a little bit more about microbiology, perhaps all the wars would stop and they would focus on this. And unfortunately, it has taken this very difficult situation and pandemic to bring us to this point. So our backgrounds are really very much suited to this, from understanding microbiology to understanding how to administer controls, to, of course, personal protective equipment, and to more technical sides of this, such as aerosol technology, which I'm going to talk a little bit about. And of course, another area of our expertise is emergency response planning and working to help folks with those. And that aspect of this pandemic is no different than if we have an oil spill of a major kind, because mobilizing, organizing, it's a big issue. And as you've seen, in our federal and state governments, they have been grappling with this. So I want to now talk a little more and very quickly about the actual the virus, the SARS-CoV-2, which causes COVID-19. Now, I am not a virologist, but we all study this. So very basically, one of the big challenges is that viruses, again, to oversimplify, really are categorized to two kinds: the DNA viruses, which are much more stable, and the RNA or retroviruses, which this one is, and also HIV. And the reason this is very important is when a virus replicates itself, it's a lot harder to study, to manage, and of course, to come up with a vaccine. And this is one of the bigger challenges. And also, as you know, the flu is with us, and the best that is able to be done is to come up with a flu shot, which, at times is effective. So basically, that's one area. The other area of concern is the fact that the virus is new. There has not been enough studies on it. They cannot, basically, they didn't know. The scientists didn't know, and now they're working on it. So now, with all of this going on, what do we do? And again, here, even though the virus is out there and millions of people have been infected by it, we still have really one major method to deal with it, and that's prevention. And that has never been truer than with this case. So the measure that everybody has heard millions of times ad nauseum is hand washing, social distancing. But the one that to me is the most critical is respiratory protection. And this is where we in the world kind of failed at the beginning. There were two, in my view, failures. One is that in a pandemic, the first 2 or 3 weeks are critical, and this is not the time or the forum to discuss that, why that happened. But the second thing is, at first there was an argument about wearing a face mask, not wearing a face mask. And here is where absolutely the blame goes to all leaders from all sides, because they did not fully understand, and this includes some scientists, this includes some scientific leaders who have government positions. They did not understand how aerosols behave. Our colleagues in Japan have a very simple video that they had a controlled environment, and they showed with a special photography how aerosols projected from our breathing zone behave. And this is not something new. This is what people in food safety have known, that we don't need to cough or sneeze to have aerosol projectilized over a few feet. So for now, even though hand washing is very critical, social distancing is very critical, but wearing proper face masks that covers nose and mouth, what we call breathing zone, and has a proper fit, is really the most important thing to prevent. So I've said a lot. I just want to stop, and then we can move on, and I'm available to discuss and answer questions.
No, that's very, very helpful. Thank you so much. I mean, I think, it's really difficult to boil this down, to the basics, but that was a great overview. I mean, Lucinette, in your experience, would you have anything to add to that?
Yes, in addition to what Hamid explained, of what's the virus and how it's spread, another thing that everybody needs to be aware of is to evaluate the risk level in your work environment. You may have all this information out there, which is new, so you may be struggling, okay, how this applies to me? Do I need to do everything and anything that they're mentioning? The risk varies depending on the type of industry. Like, for example, if your industry involves a lot of like public interaction or large confined space, meaning inside a building, and if there's like physical contact required, what the professional working spaces looks like, is it travel required, etc., etc. It's important to be aware and evaluate the risk. So that will be kind of like your one of the first things you may need to do. And then once you evaluate that, then you can apply the appropriate guidelines. So that's pretty much what I have.
No, that's great. I mean, and so Lucinette, I mean, you were obviously a very big part of that at SKC. You head the team that we have, here to do just that, just like what you said. And so one of the questions that we had was from one of our participants is, should we have a team in place to determine reopening policies and procedures? And if so, what kind of structure do you recommend? So I know I kind of cheated. I gave you this question in advance and you gave me a beautiful slide. So I'm going to put it up. And would you maybe just talk us through it a little bit?
Sure. These are very difficult times, as all we know. It is very important that there is a team in place to develop the reopening policies and procedures. Like one person, it has to be a team with different expertises. As an example, which I'm very proud of, here at SKC, we follow the emergency management procedures that you see on the slide. And we established an incident response team. And we developed this way back in February when things like started to climb and everything was like rising very quick. The team established an infectious disease emergency response plan. So it's a written plan and includes the sections like hazard risk recognition, which I described previously, what to do with housekeeping, any personal protective equipment in addition to what we currently have on the site, any work practices that we need to be aware of, travel restrictions, energy controls, labor relations, response to cases. Oh my goodness, this has so many sections. And it's what, August, almost September, and it's still an active document. And we update it periodically because this is new. Everything changes by the minute. So we are on top of things. We try to see the local news, the CDC guidelines, and we always make sure that whatever we have in that plan, it's updated. And also, we kind of like, when depending on the situation, like at this time, we kind of like in the mitigation period, but we kind of like cover every single area of that plan. So yes, Doug, do you have anything else to add?
Yeah, very good, Lucinette. Just regarding the structure on who it would be important to have in this team, we found, I guess in February, we started our first preparation meetings, and then in March it became pretty inevitable that the pandemic would be hitting us. So we put together an incident response team, and critical people in there are of course the HR department, human relations, because it is primarily a people issue here. IT, and then of course production and maintenance, maintenance for the housekeeping and cleanliness. So it's and so our initial team has also been working on the reopening issue and how we can, address those kind of issues. But the key part is this emergency response plan that Lucinette and the rest of the team have been modifying every week as we learn more.
That's perfect. That's great. That's very helpful. And I'm glad I cheated and gave that to you, Lucinette, so we could have this very nice slide here that we could look at in advance. No, that's great. Hamid, if it's okay, I'd like to go to you for our next question here from one of our participants. They asked, should we allow visitors or other outside parties to visit our buildings or offices? And if so, what guidelines do you recommend? Can you comment maybe on your thoughts there?
Right. So there is a major aspect of all of this, which is the legal and liability aspect. And a lot of entities and businesses are concerned. And this happens with real estate, people who want to go visit a home. And there has been an effort in Congress to try and provide indemnification for businesses, and that hasn't happened yet. So there are really a couple of ways to look at this. To state the obvious, this virus is extremely contagious, and because it evolves itself, the protein surroundings and other aspects of it are getting even harder to deal with. In other words, experts believe when it started, it was even simpler for the body's immune system to deal with. So the reason I say that is there are no guarantees. However, life and business and the world have to go on. And again, I'm taking a bit of a background talk about this because it's important to put it in perspective. Again, unfortunately, a lot of this response to this pandemic has been marred or enveloped by politics. But we need to really set all of that aside and look at it as scientists and practitioners, and then also at the end of the day, running a business. So to me, there is always a risk. There is always a challenge because somebody may come and claim, well, I contracted this virus from going to a place. So the entities that have been dealing with this have been real estate folks, hotel owners and operators. And as I don't know if it was mentioned, in our national association, which Lucinette is a board member, American Industrial Hygiene Association, which many of you are aware of, we have had an effort, several of us, I'm a part of it, calling back to work safely. Now, I kind of argued and said, well, we should say back to work safely with modifications. So we've been working with different businesses and entities and organizations. One of them has been the American Dental Association. So kind of putting all of this together, dentists have decided for the most part to open their businesses. Now, why do I single that out? It's because dentists, next to respiratory therapists in hospitals who intubate patients to start the ventilator, have one of the highest risks because they're very close to the breathing zone of the patient, and they're working directly at an area that they can be exposed to aerosols. But they've decided to open. So at first they were seeing emergency patients, and now they're seeing everybody else. So if it's my business, would I allow visitors? I think with modifications and with conditions, each business can decide on their own, but it is possible to have a station, to have a disinfection, have disinfecting materials, taking a temperature which it's not at all conclusive, and administering a questionnaire. That if people are more risk averse, they can come and say, well, you can sign something that you're coming in. So that has been a challenge. That the bigger challenge is for employees. So I'm going to stop again because there is so much. I hope it at least sheds a little light on what perhaps people are grappling with.
No, that is very, very helpful. Thank you. I mean, I don't know, Lucinette, do you have anything to add to that, or your thoughts just from SKC, or?
Yes, I'm just gonna do an example using us as an example to the situation. It was very, very difficult, as Hamid was mentioning, to decide whether or not we wanted to accept visitors on the site. So the approach that we did was we sat down and analyzed what type of visitors do we receive, because yes, there's like normal, so to speak, visitors that we receive, but also there's deliveries, what type of deliveries, people that need to come in to repair an equipment. So whenever you're dealing with this situation, you guys have to sit down and evaluate what is our daily day in our site, and then based on that you have to do modifications. In our case, depends on what type of visit we will receive. We have different guidelines, if it's like 15 minutes or less, or 15 minutes or more, like if a questionnaire, temperature screening, the person be escorted to provide a service. So you guys have to think of all what you need to do on a daily day, and then modify that accordingly. So because what you don't want to do, or what you don't want to happen, is like an outside person that may be exposed or have been exposed or whatever realm come in, and then if you not control it, then you will have an outbreak, and that's what you want to prevent.
Yeah, this is Doug. I'd like to add another comment. Thanks, Lucinette and Hamid. Just another angle of this about allowing visitors is allowing our staff to travel to other companies. Mm-hmm. We've from the beginning, anybody that could work from home has been working from home. There's quite a few folks here in production in the warehouse that of course did have to come in, and we've got the temperature screening and policies in place for that. But now as the world is reopening, there's the need and desire for staff from SKC to travel, primarily the sales folks. And so we have a program in place that prioritizes the visit. We review the regulations in the state where that person may travel. Also the quarantine requirements if they return to Pennsylvania. There's about 30 some states that if someone from our company visits that state, they can't come into the office for 2 weeks. So we review all that, make sure that the employee understands the situation, and the bottom line is to keep everybody safe, our employees safe, and to keep our customers satisfied.
That's great. Thank you to all three of you. I think that's a big question on a lot of people's minds here. Um, and I think our next question that we had, this came up several times, and so I think that's a clear indication that it's on, top of a lot of people's minds. So the question is, what are the best practices for monitoring employee health, and do we need to implement temperature screenings for our on-site employees? And so, Lucinette, I know this was something that you really worked a lot on. So can you maybe speak to your experience and your thoughts on this one?
Sure. This was a very another tough topic. Just because there's a lot of like HR related issues that we need to cover prior to even think about this, right? Because we just want to make sure that not only people are working safely, but also to protect their privacy and all related to that. What we have done is like we follow the local government guidelines, which are based on the recommendations from the CDC and the WHO in general. And then current practice varies depending on the situation. So we evaluated different situations here. Like for example, if we have an employee that is considered a probable or suspected case, or under its respective definitions, because there's definitions into this, the temperature screening, we decided that it was going to be mandatory for everyone coming at the site. So how does that work? We have a procedure in place where employees have one entrance to the site. That way we can control everybody's whenever they go in. And then we have like a temperature screening station where some of our employees give each employee a questionnaire to fill, and temperatures are taken using a contactless thermometer. And then this specific employees that we have that they do the temperature screening, of course they have the personal protective equipment, and the employees that are getting the temperature, they stay inside their car. So it's a process where there's no contact people, and then we follow social distancing. So it's a very smooth process so far. And then our procedures depends on the temperature. The target, of course, is 100.4 Fahrenheit. So if an employee has the temperature at or above, he or she has to wait in the isolation room. We have like an isolation room for those cases, and that person needs to wait approximately 15 minutes, and we will recheck that person 2 more times. And then once that happens, because body changes, and so we just want to make sure that we get accurate readings. So if the employee has a consistent temperature that is less than the target, and it does not present any of the symptoms, which isn't that there's those information is included in the questionnaire, then they can go out to the site to work. And then for those employees having a temperature at or above 100.4, then HR is informed, and then we evaluate the case. And then when we don't have like a probable or confirmed case, the temperature screening is not mandatory. However, many of our employees still go through the process, still go to the temperature screening station. And then whenever we have a case, we handle them independently. However, we follow the same investigation process. We conduct like contact tracing investigation. So we track as much as possible where this employee worked, who she talked to, got in contact, all that stuff. Then we determine if areas needed to be closed and proceed with decontamination procedures, and then evaluate the procedures of returning to work for that employee. So we have a very conservative approach here. Safety is our main priority at the site, and we try our best to keep things under control. So far, the process has been going smooth, and whenever we have to change things, we do it quick. So Doug, am I missing anything?
No, Lucinette, that covered it very well. You know, just we've been doing the temperature screening early on and the questionnaire. Another thing that's just been really important is the ability to easily contact trace when people are limited to certain areas and certain restrooms, for example. So if we do have to do any contact tracing, again, we can identify people that may have been exposed or areas that need to be disinfected.
Awesome. Thank you both very much. I don't know, Hamid, do you have anything maybe that you'd like to add to that about temperature screenings?
The only thing I wanted to add is that, as Lucinette and Doug mentioned, there is no one aspect of this to rely on. You know, when the avian flu started and H1N1, I remember in Hong Kong at the airports, they had this infrared thermometer scanners and things. Now, I think that's a very good idea. But to me, the most important thing that is happening is really worldwide and in society and companies too is training. And this is where what we call total worker health, the 24/7, what folks in Scandinavia and others have done. That those 8 hours that people are at work are not the only time they get exposed. And in this case, it's very clear. So the training is important, and also questionnaires to let folks know, are you wearing a mask when you are not at work? And then, asking about, their contacts. And what Doug mentioned, one of the most important parts of controlling a pandemic is contact tracing. And now, with all the apps and all the high tech we have in our society and in the world, we will not be able to manage this ultimately, especially since it's a retrovirus, without contact tracing. And hopefully we'll be lucky to get a vaccine, but most probably it's going to be a type of a solution that's going to be partially effective. And then as far as temperature control, it is, of course, not ideal to use contactless temperature, but really if you want to have a type of temperature taking that's got the contact, then you have other risks. But I just wanted to mention, as long as it's not a reliance only on these thermometers, because they really are not fully designed for taking humans' temperature. A lot of times they underestimate, but I think combination of all of them would be great.
That's great. That's great. Maybe just a follow-up here that we've gotten on the chat bar. Lucinette, I'd like to throw this to you first, and then have others chime in as well. But this question says, with a communicability time of up to 7 days, what is the benefit of doing temperature screening? There is always the possibility of someone not having any symptoms and being contagious. Do you have any thoughts, Lucinette?
That is a challenge. 7 days is a lot, and many things could happen in 7 days symptom-wise, and it's a challenge, especially for the people that are asymptomatic. Hamid, if you have something to add.
Sure. Sure. Yeah. So actually, and unfortunately, I wish it were 7 days. It's really, to be sure, it's 14 days, and. I always tell folks, including people in our field and the audience who are knowledgeable and experts, there is a matter of, you've seen this, I'm sure, in your children and teenagers. People get upset about some of these aspects of it, but it's just a reality. And the reality is that it is 14 days. And one can look at the success of New York, New Jersey, and Connecticut with administering as much as possible quarantine, and then the firm ones, the best examples are Hawaii and New Zealand. So in a way, the aspects of the program that Lucinette and Doug mentioned, that's a very great program, but it's not fail-safe because we are dealing with an invisible, a very, if I may use a strong word, sinister virus. But these steps are tremendously helpful because in epidemiology of a pandemic, you don't need to go and get everything to get to a 0% risk. Of course, that's ideal, but it's not possible. But if we can, what we call disconnect the connection between point A to point B to point C so they don't get to point D. You are going to be able to break the back of this pandemic. And that's how it has happened. Ultimately, border controls, contact tracing, having aerosol preventive protection, the PPE, and what employers such as the SKC are doing would all help. And I know because folks are saying, well, what about this or what about that is not, fail-proof. And I agree, but I think actually I believe the combination will defeat this. And it is the positive, I shouldn't say that word, is the fatality rate of this is lower. And if we administer all these steps, we will prevail. And I wanted to also say one more, if it is a positive, is that hundreds of thousands of scientists, and I'm a small part of it, who've been saying, let's look at viruses and microorganisms. This has awakened the world, and we will never forget it, so we can do preventive work. And let me just say one more thing. As one who's been traveling around the world for 35 years, and Doug and I are similar in that, how many times have we been exposed when people had the flu and would get on a plane? I can tell you that's not going to happen again. So we're also going to prevent other communicable diseases and have a healthier world. So I've always been accused of looking at the world through rose-colored glasses, but I think this is the time to do that.
That's great. I think that's an important message, right? The cumulative efforts. And I think that's really very well said. Thank you. Thank you both for that. Hamid, I want to toss it to you here. One of the questions that was submitted in advance was asking if are there any precautions we need to be aware of related to reopening and Legionella? Can you comment on that?
I'm sorry, reopening related to Legionella?
Correct. Yes.
Okay. Yeah, of course, especially on the East Coast, and we know what happened in Bronx 2 years ago. So if the question is if the systems, the HVAC systems and the cooling towers were not managed, so of course they have to look at it. I assume that buildings have been managed, so the HVAC system and the disinfection procedures are in place. So if there are buildings that their HVAC systems, including the cooling tower, have not been managed professionally by the HVAC teams, or if they're contracted out, I think it's very important to have the system tested for the Legionella organism and to go deal with it, because one just needs to drive through Manhattan and see all the rooftops. There are the cooling towers in Pennsylvania and elsewhere. So yes, by all means, please talk to your building maintenance and remind them that if a building, all the buildings' HVAC systems should be under Legionella maintenance program and testing. But if they haven't done it, absolutely.
Great.
Oh, go ahead, Emmer.
No, please, Lucinette, go for it.
No, it's just interesting that we're dealing with this type of microorganism, and it just can lead to other microorganisms such as Legionella. Fortunately, there are references out there that the maintenance crew and each site or the HVAC experts can use. Like ASHRAE has its guidelines to handle the ventilation for during this time. Unfortunately, on top of my head, I don't have the number, but it just talks about, it's evaluating what type of system you have, and then just depends on that type. There's some guidelines on how to evaluate, because as Hamid said, it's very important that you address it, because you can solve one issue, but then if you don't address this other part, you may have a Legionella problem in the site. So it's a lot, but it's just a matter of evaluating what you have and use the resources available.
Wonderful. Thank you so much. Thanks to both of you. All right, let's take one of our next here pre-submitted questions. And Doug, I'd actually maybe like to start with you on this one, just thinking about it, from a leadership perspective, right? communication is obviously a big part of, any reopening. And so the question is, what are your recommendations for communicating reopening policies, procedures, and other information to employees?
Well, thanks, Amber. That's a good question. I guess my priority here is regular, complete communications to try to be as transparent as possible. So we've set up a couple of systems. Whenever there's immediate news, we have a service that can immediately send a text message to everyone or a voice message. And so if we're closing or opening or something like that, we'll use that form for an immediate message. And then we try to do regular communications to all employees just through memos. Our marketing department's put together some nice videos that we have streaming in the lunchroom. And it's just really important to talk to the managers and the team leaders and everyone in the company to make sure that there's, to answer any questions or concerns that might exist out there. It's so critical. The rumors with any company travel pretty quickly, and so the faster, the more complete we can share the information, the better off everybody is.
I think that's a great point. In the absence of information, people will fill in the blanks for themselves, right? And that's what we want to avoid. Lucinette is sort of like the leader of the team, that team that you talked about at the beginning at SKC. What are your thoughts on this, the communication piece?
It's very critical because there's a lot of information out there, and some of them are good information and others is bad information, and it's important that people understand what is the difference between them, right? And based on that information, what we can do, because what we want to prevent is chaos. As human beings, where we are in a difficult situation, we tend to react. So it's the way, it's how we react to the situation. So if we keep focused with the facts and also with an open communication, I think it will be smoothly. I'm not saying easier, I'm saying smoothly. And I appreciate, Doug, you're a wonderful leader. You're on top of things, and I appreciate all the work that you do for us.
Well, thank you. Same to you.
That's great. Hamid, any thoughts, from your perspective, just on the importance of communication, and if you have suggestions there for the people who are participating with us here today about that?
Yeah, thank you. I've always believed, and even philosophically, human beings are, we're creatures that have the ability to be educated and to learn. And there is nothing that's going to replace training and communication, and of course, building trust. But as simple and as basic as this is, the most important thing is training and education. Now, employers also have the many challenges, commuters, people working from home. But one of the things that we need to realize, and a part of occupational health and public health, we have 4 aspects in our field. We call it physical stressors, chemical stressors, biological stressors. But the psychological aspect and stress is very important. And again, you've heard in regular media and more scientific journals that the level of psychiatric concerns is very, very, very important. And the way things work in the epidemiology and spread and incidence and prevalence of psychiatric disease, which is the same as physical diseases, is that when that stressor is higher, then all of a sudden a higher percentage drop into the levels of depression and other issues. Again, I'm not a psychiatrist either, but employers need to also be aware that everybody is under pressure, including managers and leaders. And this is the time to look at it as if we are in a war with an invisible enemy, but that we all are in it together. People's tolerances are lower. Another thing, again, that we all have noticed, that children are at home, those who are having to deal with kids, a 10-year-old or 8-year-old doesn't sit in front of a computer easily, so parents are stressed. So I just wanted to take an opportunity and a moment to talk about that in addition to the fact that it's training, that collaborative support that executives such as Doug really exemplify, they're also very important.
That's very well said. I think you're right. That's probably not something, that we talk enough about, but I think that's really very well said. Thank you all for your input there on that question. So taking a question here from the chat bar, and Hamid, I'd like to start with you because you really emphasized this at the beginning of our session, talking about respiratory protection. The question is, what do you consider face coverings, and can you address proper fit with a cloth face covering?
Well, the short answer is no. But the reality is that if everybody covers their breathing zone, nose and mouth, that is going to go a long way to prevent aerosols to be projectilized, to be airborne. So that's really the number one. And I have seen all these masks and face coverings that are being manufactured, they're getting better. They're progressively getting better. And as those of us in the field very much realize, is of course the minimum respiratory protection that you can issue is an N95, but that is neither practical nor really needed. I advise the California Hospital Association, and many of the hospitals in California are not issuing N95s to everybody. They're issuing just a simple surgical mask with a bit of a clip on the nose bridge so they can get a better protection. And they've left N95s and PAPRs for those who are dealing with active symptomatic COVID patients. So do I believe that we should move towards much better face mask than a bandana? Yes. So I think what we need to do, there is a balance here, to encourage everybody who can manufacture to have proper material that can, basically prevent aerosols from being transmitted, but also as much as possible a fit. And if possible, to have the band to not go behind the ears, but go behind the head. Because as you know, if issuing an N95, the exertion that it causes on the body, we can also have other problems. Now, I myself have been flying and I use an N95, but because I have the training and I've been medically fit tested. So the summarize is, if we can get the face mask that as much as possible cover the breathing zone and provide a bit more of a regular than the regular mask provide around the nose bridge, and then religiously do that, then we'll go a long way to deal with this. And N95, for the most part, would not be something that's practical. And I want to also take a quick segue and saying that when this started, SKC and SKC West provided me about 300 N95s, and we distributed those to doctors and dentists and others. And I have emails from all over the country saying, oh, this was life-saving. So thank you, SKC.
No, thank you for that. I think that's such an important question. We hear this a lot. I mean, Lucinette, do you have any thoughts about face coverings and proper fit with cloth face coverings? Anything to add to that?
Yeah, just supporting what Hamid said. I mean, industrial hygienists think alike at this point. Yeah, bandanas or similar types of face coverings, I mean, we're not too happy about them. It's better ways to assess respiratory protection, but also we have to think about, who are, like, for example, N95s, who need that most, right? So as Hamid said, it's a balance. As long as we use the best that we can get in the proper way, it comes a long way. The important part is that we use the face mask. We need to follow that variable because it makes a change.
That's great. That's awesome. All right, I want to go to one of the last questions that we received in advance. And so the question was, what third-party reference sites do you recommend for additional information and guidance? I think, I think this just speaks to there's a lot of information. And I think, Lucinette, you kind of pointed out there, in one of your responses, some of it's good and maybe some of it's not good, right? I mean, and so we do have to be careful. And I think people are sort of searching for, what are the best places, to go for some of this. So you provided me some of these, in advance. And so can you maybe start us off and talk about some of the places that you go for your information?
Sure. For references, as Amber clearly said, you have to be careful where you go. And there's these sites here that are on the slide are the main ones that have, the most updated information and the most accurate. As you know, CDC, also the World Health Organization, or WHO, but also the AIHA. I mean, they have worked very hard to develop a coronavirus outbreak resource center, which there's the link over there. And also they develop a back to work safely. And Hamid was mentioning too, this websites, they include like webinars, posters, brochure, a lot of information out there. And Hamid, I know you were part of the task force. Can you provide like your experience with it?
Sure. So there are now almost 20 people with expertise in different areas. So the first one was on construction, because the guidelines went through the White House, and for certain reasons, construction was, of course, number one. But there is a group of technical professionals, volunteers, plus the staff of AIHA who have worked on these. These are available, as Lucinette said, on the AIHA.org website. It's very extensive and has a lot of good information. But I also wanted to mention, related and continuing on what Lucinette said, in graduate school, even undergraduate, it is always thought that internet has more information than the Library of Congress. However, if you go to Library of Congress or major university libraries, you have a reference librarians. Here we don't. So the important thing is, in my view, there is not a need to go to tens and tens of websites, because it can be conflicting information. Those that Lucinette mentioned, the CDC and World Health Organization, are critical. Then I would add two more. One is federal OSHA, because of the regulatory updates. And then if you are in the 26 states, such as California, Washington, Oregon, and others that have their own, those websites are also very important, because they have information for employers. And then, of course, NIOSH, our dear colleague, Dr. John Howard and his team, and Frank Earl and others, have tremendous information. So I personally do not recommend many different ones. But some of the major universities, they have environmental health and safety offices, such as UCLA and Harvard and others, and those are very good. But other than that, I think, I'm not discouraging folks, but because there is such a deluge of information, that those would be the best to look at.
I think that's well said. Very, very well said. Well, I think that is all we have as far as questions and everything today. And it looks like just in time. So, I mean, as we close out our session this afternoon, I want to thank all three of our panelists for joining us today and sharing their expertise on this very, very important topic, very timely topic. And a big thanks to all of our participants for participating in this conversation. So just a reminder, I think we got to all questions today, but if you have follow-up questions afterwards, we welcome them. Please send them our way, and you will get a recording of this session so that you can go back in and reference it and make sure that you get any of the additional information that you need. So thank you, Doug. Thank you, Lucinette. Thank you, Hamid, so much for sharing your expertise with us this afternoon.
My pleasure.
Thank you. Thank you, and stay safe.
Yeah, thank you, everyone.
All right. Stay safe, all. Thank you so much.
Bye-bye.
Bye.
Bye.